want to protect people's jobs. These are folks that have been working throughout this whole time. They were put in situations where they were exposing themselves to risk knowingly to help others, and they did that, and we considered them heroes just a year ago. Now you're going to let them go by the wayside. You're not going to let them work anymore and kind of throw them in. And here's the thing, different people have different views on this. I think most of the people in the healthcare industry, the nurses, most of them have recovered from COVID. Most of them have natural immunity. It is strong protection, and then they have other considerations that they have. Man, I think that they should be protected. Now, you're in a situation where, and we're working in my office to figure out what we can do at the state level. People are focusing on the Biden mandate on employers. So you have a company that has 150 people. Biden is now coming in and forcing you to force the employees to do these things. That's obviously going to cause different folks to potentially lose their jobs. It's going to be bad for the employees, and it's going to be bad for the businesses. And that's the kind of the thing that affects most. But they also have an a mandate on any entity that gets Medicare and Medicaid. So they're threatening these hospitals. If you don't do this mandate, you don't get reimbursed from Medicare, Medicaid. Well, the hospitals, you can't do business because most of your patients are Medicare patients, particularly in a place like Southwest Florida. So I think that's unconstitutional what they're doing. I think it's illegal. I don't think they have the authority to just issue these dictates and threaten to pull off. Who knows how much funds that would end up being? So I think a lot of the hospitals are responding to that federal kind of sword of Damocles that the Biden administration has placed over their heads. And what's the results going to be? Exactly what you just said. You're going to have some people that decide to walk away. This is at a time where you have acute shortages in healthcare workers. Now in Florida, yesterday we pointed out, from the time we started our monoclonal antibody program, we have 52 straight days of a decline in COVID-positive patients in hospitals throughout Florida, 57 straight days where the 7-day average of new admissions has declined. Our admissions are down, I think, close to 85% since we did that. So we're in our infection rate is one of the third or fourth lowest in the country now. But there's still other things that need to be tended to. It's not just COVID. Even at the height, out of like 64,000 beds, you had it's not like most of those were COVID. I mean, it was always less than half. I think it was about a third at the peak statewide. And so you have all these other issues that need to be tended to too. But then when you see Delta has not done waves in other parts of the country yet. It's unfortunately probably going to do that. What are they going to do this? And so I just think it's big. But ultimately, I think the root of that with healthcare is Biden trying to force every pretty much healthcare provider that accepts Medicare or Medicaid. They're threatening to cut that off if you don't impose this mandate. So we're looking at options